All right, hello everyone and welcome. In this explainer, we're going to tackle something super high yield, the key gynecological instruments you absolutely have to know for your practical exams. Let's jump right in. So, have you ever been in that situation? You're in your practical exam, there's a tray of instruments, and you just feel completely lost? Yeah, we've all been there. That heart-stopping moment when the examiner points to some shiny metal thing and says, "Identify this and tell me two uses." Well, today, we're going to flip that script. We're turning that anxiety into pure confidence. Okay, so here's our game plan. We're going to take a really logical outside-in approach. We'll start with urinary catheters, then move to vaginal speculums, and finally, we'll look at the instruments that actually access the uterus. After that, we'll wrap it all up with some critical clinical pearls and a super quick recap to make sure it all sticks. All right, let's kick things off with the urinary system. You're going to see these instruments a lot, and they're used for both drainage and diagnosis. First up, we have the Foley's catheter. Now, this is your absolute go-to for continuous bladder drainage. And the most important feature? It's right there in the name. It's self-retaining. That means it stays put all by itself, no need to hold it in place. So how exactly does it do that? What's the magic behind this self-retaining feature? Well, it's pretty clever. It's made of this flexible silicone rubber and has two channels inside. One channel, that's for the urine to drain out, obviously. But the second one, that's the key. It connects to a port where you can inflate the tiny bulb with sterile water. This little balloon then sits inside the bladder and acts like an anchor, which keeps the catheter from accidentally slipping out. Pretty smart, right? Okay, so where would you actually use this? Well, you need to think long-term or continuous drainage. For example, postoperatively, after a big surgery like a hysterectomy, it keeps the bladder empty so everything can heal properly. It's also absolutely crucial for managing acute urinary retention or for keeping a close eye on urine output in critically ill patients in the ICU. All right, now let's bring in its simpler cousin, the simple rubber catheter, sometimes called a Robinson catheter. Look at them side by side. The first thing you'll notice is what's missing on the simple one, right? There's no inflatable bulb, and there's no second port for inflation. That's your key visual giveaway right there. And that visual difference points to a completely different function. This is super important. The Foley's is for continuous drainage. It's designed to stay in for hours, maybe even days. The simple rubber catheter, on the other hand, is for intermittent use. You might hear it called in and out catheterization. You just put it in, empty the bladder quickly, and take it right back out. So one is an indwelling device, and the other is for a one-shot deal. Okay, so we've covered the bladder. Let's move a little deeper into the vagina. Now, to see anything clearly in there, you've got to open up the view, and that is exactly what speculums are for. And here it is, the classic Sims double-bladed posterior vaginal speculum. Its main job, its whole purpose, is to pull back the posterior vaginal wall. Why? So you can get a perfectly clear direct view of the cervix. Now, for your exam, this is a huge giveaway. Take a close look at the two blades. You'll see they are different sizes, right? They're unequal. The narrower blade is for nulliparous women, that is, women who haven't given birth. The wider blade is for parous women, who have. I guarantee you that's a classic Viva question. Oh, and also notice that groove in the middle? That's there to let any secretions or blood drain away so your view stays nice and clear. So what do we use it for? Well, it's all about seeing and getting to the cervix and the upper vagina. This is really your workhorse for all those common outpatient procedures, like collecting a pap smear, taking swabs for a culture, putting in or taking out an IUD, or even doing something like a cervical punch biopsy. All right, our journey continues. We're going even deeper now, moving past the cervix and right into the uterine cavity itself. The instruments we're about to look at are all about assessing and prepping for procedures that happen inside the uterus. And this is a uterine sound. Now, the name can be a little confusing. It has nothing to do with audio or sound waves. In this context, to sound something means to measure it or explore it. It's basically a thin, malleable metal rod that you use to very gently check out the uterine cavity. So what are its jobs? Well, first we use it to confirm which way the uterus is pointing. Is it anteverted, tilting forward, which is the most common, or is it retroverted, tilting backward? Second, and this is a critical safety step, we use it to measure the length of the uterocervical canal before we do something like an IUD insertion or a DNC. The normal length is usually around 7.5 centimeters. And finally, it also acts as the very first and smallest dilator in a set. Okay, let's do a little Viva prep. Imagine you've just correctly identified the uterine sound. What's the examiner's next question going to be? I can almost guarantee they're going to ask, what are the main risks or complications of using this instrument? And here's your perfect high-yield answer. Uterine perforation and hemorrhage. Because you're doing this procedure blind, you can't see where it's going. There's always a risk that you could accidentally push the instrument through the wall of the uterus. This is especially true if the uterus is sharply angled or if the wall is a bit weak. And that is exactly why you have to be so gentle when you're using it. All right, let's pull all this together into a few key takeaways. These are the absolute must-know, high-yield facts that are going to score you easy points in your spotters. Okay, you ready? Rapid-fire review. Foley's catheter, the magic words are inflatable bulb for self-retention. Speculum, the key is unequal blades, narrow for nulliparous, wide for parous. Uterine sound, remember, its gentle curve is designed to follow the natural anteversion of the uterus. And here's a bonus pearl for you, the rigid metal female catheter. Great for emptying the bladder before surgery, but it's a big no-no in obstetrics. You just want to avoid any potential trauma. Okay, let's do one last super quick recap. This will give you a simple mental map to remember all of this. Honestly, it's as simple as this. Think about the anatomy from the outside in. Step 1, catheters for the bladder. Step 2, speculums for the vagina. Step 3, sounds for the uterus. If you can just remember that simple progression, bladder, vagina, uterus, you can logically figure out the function of each of these instruments even when you're under pressure in an exam. So, I'll leave you with one final question to think about. Now that you can identify all of these instruments, which one do you think carries the highest risk of iatrogenic injury? Harm caused by a medical procedure, if it's misused. Really think about the structures they interact with. All right, that's it for this explainer. Best of luck with your exams.